Hey all, welcome to another edition of Steve in the Car on the way to Pain Lab. Hope everybody's having a nice day. It's 56 degrees, blue skies, Wednesday morning. Can't complain, starting to feel a little bit more like fall. Pretty pleasant, I have to say. So today's topic around the subject of Pain Lab is pre-post surgery for the purpose of healing and recovery. Now, we are working with some patients, right, who have long-standing pain problems, and in some ways, our stimulation therapy helps. Certainly, it helps just in the material sense that we are engaging blood flow. We're getting the nervous system, the neurological system to function better. But when you have had a specific, let's just say age-related arthritic bone-on-bone problem for years, it's a bit of a tall order to expect that our therapies are going to right that situation in a short period of time. Some long-standing scenarios take time. You know, somebody's had a problem for 10 years. Obviously, it isn't a crazy thought to think that it might take a little while to get that scenario reversed. That being said, even if a patient should decide that the therapies are helping, but they aren't helping enough for a particular scenario that will ultimately require a surgery, for instance, a knee replacement, a hip replacement, what we offer still is inherently beneficial to that individual, both before the surgery and after the surgery, from the standpoint of making that tissue, that bone, that nervous system, that blood flow healthier prior to surgery and healthier after surgery during recovery. And we have seen in different cases the recovery times are shortened significantly because this electromuscle stimulation and light therapy are doing just what I just said, doing those things, getting the body to function better around that pain point, that problem. So an ACL tear, which led to a surgery for a young lady of 18 or 19 years old, college soccer player, the expected recovery time is between 6 and 8 months. Hers was reduced to 4 months. And during the recovery process, she was able to add diameter to her thigh, believe it or not, through exercises that she was doing with the suit. So recovery is a very different experience when Neuro20 is involved, when Firefly is involved. Now, I think it's helpful and it makes sense to try to avoid surgeries. But when it has come down to that, using our system for prep and for recovery is a fantastic idea. And people who have been through it will definitely agree. So I want people to keep that in mind as they're going through their journey of life here, and they encounter these types of potentially degenerative problems, arthritis being one of the main ones, where it's wise to try to prevent those types of things and to try to work with the problem. But if it should come to the point where surgery is fairly inevitable in order to restore some quality of life, just know that having come to Pain Lab before and after is not a bad idea at all. It really will help for that recovery process, and frankly, I would say give the surgeons a better body to work with, right? Sometimes a hip replacement, for instance, can be a pretty harrowing event for somebody who is physically weak and unhealthy. And I know because I've been around the subject of hip replacement. A friend who I am directly involved with her health care had to have a hip replacement, but unfortunately she had been in a wheelchair for a number of years, so her bones and muscles were weak. Right, they were not up to just a normal standard of health, and unfortunately, in the rather vigorous process of removing her hip, her femur cracked. Right, and that was obviously not the expected outcome, so they had to stop the surgery, patch her back up, let her heal, and 8 months later she was able to get the surgery successfully, with a few physical therapy processes during that time, getting her to a point where she was a little bit better prepared for surgery. Now that's obviously a rather polarized example. It's kind of an nth degree scenario. Most people have a successful hip replacement surgery, but the point is, for those who can get in to Pain Lab prior to some kind of a joint replacement, etc., you will not regret it, guaranteed. And so feel free to reach out to us anytime about that and talk with Dr. Anderson or myself about what that can entail. And that's it for now. I appreciate you listening, trying to keep these videos relatively short and informative. Hope you all have a great day, and we'll see you again soon.